The brain is the master control system for the entire body. Protected by the skull, it sends and receives signals down the spine through the spinal cord.
A spinal disc consists of two main parts, the jelly-like nucleus pulposus in the disc's center, and the outermost layers, collectively called the annulus fibrosus. These two components facilitate the spine's movement and provide support for the vertebrae. Disc generation or trauma can cause the nucleus to herniate through the weakened layers of the outer disc and leak out of the annulus fibrosus into the spinal canal. In the case of a lumbar herniated disc, the weak spot in the annulus fibrosus is directly underneath the spinal nerve root, so a herniation in this area can put direct pressure on the nerve. The nerve root extends down the leg, and any type of pinching or pressure on the nerve in the lower spine can cause pain, numbness, tingling, or weakness to radiate along the path of the nerve down the leg.
At the Spinal Health Institute, we've seen hundreds of disc conditions treated successfully with the disc pump.
The disc pump treats injured discs with precision, tractioning one specific disc at a time. With less than 10 pounds of pressure applied to the skin, the disc pump gently separates the two involved vertebrae. The separation of the vertebrae causes a suction on the disc, forcing it to slide back into the proper position. When the disc goes back into its correct anatomical position, pressure is removed from the spinal cord, often alleviating pain.
There was no side effects, no pain, and it works real well.
It is important to note that this is a non-surgical procedure. The disc pump is gently applied to the patient's lower back or neck. Most patients experience relief on the first visit. While cases vary, patients typically see pain relief in 3 to 6 visits.
And the first treatment I got, I felt like a new person. I went down to the racetrack and I prayed around the races for 11 races. The disc pump has helped me tremendously.